When you hear a person's getting a knee replaced or a hip replaced, you'd think it was a big invasive procedure, right? And it is to a certain degree.
Well, here with more insight on knee and hip replacements there at Gibson Area Hospital, we have Dr. Brett Keller joining us now. Welcome, Dr. Keller.
Thanks for having me.
Well, we're glad you're here. We're talking all things knee and hip replacements, but it sounds like there's some pretty exciting technology that you're now capable of using. Tell me about it.
Absolutely. So we're now doing what's called robotic-assisted knee and hip replacement. You might hear it as Stryker Mako-assisted robotic arm technology. So we're able to use this technology to perform knee and hip replacements.
What does, I'm trying to figure out, like, in the actual operating room, what this looks like.
Maybe it looks like that?
I mean, okay, so is that the machine? Are you using like a Nintendo controller kind of thing to move this around, or how does that work?
Absolutely not. I'm actually controlling the robotic arm there. You see in that picture. That's our Mako robot. It's in the operating room. The arm on the technology is what we controlled during the procedure. So I'm doing the surgery, but controlling the arm, and the arm helps us put these knees and hips in very accurately.
So besides being just kind of super cool, how is this different than how you did it before?
So it's different in that we do a CT scan, which is a fancy x-ray prior to the surgical day. We make a plan off the CT scan. So we basically make a three-dimensional model. So going into the surgery, we know exactly how we're going to put the knee or the hip into the patient.
And this is happening, it's an arthroscopic procedure, I'm assuming, where there's not too many incisions, or how does that happen?
This is actually an open procedure still. Okay. In the OR, because the incision has to be still large enough to put the components into the joint. But it really has allowed us to put these in more accurately and improve the recovery for our patients.
Okay, because those sound like some pretty big benefits of this new technology with the recovery time and the success rate. So what kind of recovery time difference are we talking?
So the recovery time, in the first few weeks, we're getting people into physical therapy that first week, as opposed to maybe 2 weeks out. So our patients are done one day, maybe two, the second or third day, right into physical therapy, outpatient physical therapy, moving up, walking sooner, and oftentimes having less pain. The biggest advantage is that the knee feels more stable. It feels more like your natural knee.
Is it an outpatient procedure to begin with? Are they in and out of the hospital the same day? Is it overnight? How long are they actually there before they're allowed to go home?
In some patients, it can be done outpatient, but typically we're keeping patients overnight at this time. In the right patient, they can go home someday.
So are there some candidates who this may be a good option for versus the old technology with other patients? So
at this time, I'm using the Mako robotic system for all my patients for knee and hip replacement. So everyone's a good candidate.
Okay.
Yeah,
well,
it's
I'm
amazing.
glad mine aren't there yet, but it's good to know.
Maybe closer than I'd like them to be. What kind of, from how you learned to do surgery in medical school to now, what kind of training and process did you have to go through? Was there much of a learning curve for you? Was this a whole new procedure for your brain and your hands to do, or is it fairly similar?
The process took about a year in training, going to different sites, training with different surgeons. The actual process isn't a lot different than what we were doing previously. Prior to robotics, we were doing navigated total knee and total hips, which is kind of the next step from traditional knee and hip replacement. So it's kind of a natural step for me to go to the next level of technology.
And this is good for total or partial when we're talking about replacements.
That's correct. It is good for partial knee replacement in the right patient as well.
Okay, so if somebody's out there and they're like, oh, my hip, I need a new hip, and they want to learn more and see if this is a good fit for them, what do they need to do?
So I would encourage patients to go on the Stryker website to learn more, number one, about the actual replacement procedure. And most importantly, if they think they might need to see us, is to call Gibson Area Hospital, seek an appointment with me or one of my associates at Gibson Area Hospital, and we can discuss options about knee or hip replacement.
Yeah, so that we can get you back up and running and dancing and shaking and all that fun stuff. Dr. Keller, thank you.
Those are things you would like to do, yes.
Yes, absolutely.
Great. We appreciate it. All those details again, CILiving.tv.